We're here. Good morning. I had a phone call. I was trying to juggle three things at once there. And welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas. He's Bill Kearney. And let me catch my breath there. Yeah.
Getting ready for the holidays.
Getting ready for I'm trying to lose the weight so I can put it back on.
Yeah. How many pounds now?
7 more pounds.
7 more
30
pounds.
total.
30 total pounds.
Yeah, it's amazing.
This guy is trying to get healthy on us, and it's merited. I mean, he's really looking good. So, been taking
looking
care
better.
of himself. And
I wouldn't go that far.
Yeah. Well, we're going to have our annual Thanksgiving show next.
We are going to do it
next Wednesday, and we're probably going to get off the wagon a little bit on that Thanksgiving Day. So we'll talk more about that next week. But congratulations. I think that's fantastic.
It is, yeah.
I just got back from halfway across the country again. I went back to Iowa to see my sister. So I sat next to this guy on the plane that had this croupy cough.
Oh, no.
And I mean, it was scary. And he wouldn't cover himself up. Finally, about this was from Las Vegas to Des Moines, and which was a 3 or 4 hour flight. And he just kept coughing, and he would cough on his right arm, which was right next to my left arm.
Oh, no.
And nice guy, but eventually he saw that it was kind of irritating me, and he got a handkerchief out of his pocket. But I don't know if I was exposed to some virus or what. This guy sounded like he had whooping cough. And
wow.
But when you fly like this, and when we all fly during the holidays, you're exposed to a lot of bacteria and viruses that you aren't normally exposed to. And even though we've had a flu shot, and by the way, we're still giving flu shots, so come on in and get a flu shot. We'll take care of you and make sure that at least you have protection against the strains of virus that are out there right now. And again, you're going to be exposing yourself, so don't wait till the day before Thanksgiving to get a flu shot. If you haven't had one, that's better than not getting it at all. But we'll be giving flu shots up to January, and maybe beyond that date, depending on the availability of the vaccine. So, but it's really important because of the exposure you're going to have to other people that you haven't normally been around, and maybe you have been, but and also in cases of newborns and those kind of things for grandparents and husbands and uncles and aunts, make sure you have a Tdap vaccine before you're exposed to a new infant, because that new infant doesn't have exposure, or doesn't have protection against pertussis, which is whooping cough. So concerns have been raised about the safety of that child when people are not getting Tdap shots. And along that line, every pregnant female gets a Tdap vaccine during pregnancy. And there has been some information for the last 4 years. It's been recommended for all pregnant women, and concerns have been raised about the safety of the vaccine for fetuses because of the increase in microcephaly. If you don't know what microcephaly is, that's the new disease that occurs with people that have the Zika virus and get pregnant, and where the head does not get enlarged and the brain does not get enlarged as much as normally. And so there was a lot of studies that were done that because people got some people got the Tdap virus their Tdap shot when they were making themselves immune to pertussis, and at the same time they might have had the Zika virus. And there was a concern about the study of increased birth defects following a maternal Tdap vaccination, although none of them really focused on microcephaly. So there was a team of researchers in Minneapolis that included more than 300,000 births, and I think these results are much more valid when that's large studies. If you've listened to my show before, you know how important that is to me. And they indicate that Tdap pregnancy or Tdap administration during pregnancy is not significantly associated with the increased risk for microcephaly or for other structural birth defects in the child. So included in that study were live births at 7 vaccine data links: Northern California, Southern California, Colorado, Minnesota, Oregon, Washington, Wisconsin. And the analysis of the vaccination from 27 to 36 weeks gestation were limited to 2010 and 2013 for California sites. It was not significantly associated with increased risk for microcephaly for vaccinations occurring at any week during the pregnancy. The results of this just kind of support what we already knew, but because of the influence of Zika virus, we thought we needed to do more studies to make sure that they weren't connected, and they haven't shown any evidence of any connection at all. That's not designed to scare you or make you more concerned. It's just to verify what we already knew as far as the value of having the Tdap shot and no complications from any other factor related to the Tdap shot. Just, I think, yesterday or the day before, Paul, I just got back in town last night, but Denver accepted having recreational marijuana in the city of Denver. Now, I don't know what all that means, and with such an impetus on marijuana being approved in the state of California for marijuana use, there was a lot of research that focused on patients with stress cardiomyopathy. Now, cardiomyopathy is when the heart muscle weakens and it prevents it from pumping. So patients with that condition, which is said to mimic a heart attack, can experience acute chest pains and shortness of breath and dizziness. It's most often associated by acute stress or grief, such as a breakup or a death of a loved one. But there have been many reports of heart attacks, strokes, and 2 cases of stress cardiomyopathy that have been linked to marijuana, just that we know about. Greater availability, of course, of the drug, particularly for recreational use, has heightened concern in the medical community about cardiac risk. So using nationwide inpatient sample data from 2003 to 11, again, huge study, 33,343 patients with stress cardiomyopathy. The data was taken from across the country and represented both men and women of varied ages. 2 groups were formed from the data. One group of marijuana users, which had 210 patients, or 1% of the total study, and a group of patients who did not use the drug. Each drug was pretty different in terms of demographics, medical histories, and outcomes. Of course, as is to be expected, the recreational marijuana users tend to be younger and more often male, and a finding that was surprising to find because stress cardiomyopathy is most often occurs in older women. They also had huge differences in risk factors because they were younger. Typically, cardiomyopathy such as acute stress, hypertension, diabetes, migraines. The non-marijuana using group had much higher rates of those conditions, even though these people were young and had less cardiac risk factors. They still had a high cardiac risk. They also suffered more from severe cardiac problems, despite being younger and with fewer risk factors than non-users. During stress cardiomyopathy, the marijuana users were significantly more likely to go into cardiac arrest, which is a heart attack, and to require an implanted defibrillator to detect and correct dangerously abnormal heart rhythms. Investigating it further, they created a model that excluded all the known causes of stress cardiomyopathy to see whether marijuana users alone could trigger the condition. They found a statistically significant relationship between drug and stress cardiomyopathy. Someone who uses marijuana is almost 2 times more likely to develop cardio stress myopathy. They also found that marijuana users were more likely to use tobacco and illicit substances as well as suffer from depression. So this study was done at the University of California, San Francisco School of Medicine, and it continues to stress cardiomyopathy among marijuana users. Now, of course, the question becomes, with the overall concern of this new study, does it give somebody some appropriate worry that exposure may not be as benign as some people seem to think? And you know my feeling on recreational marijuana. I just think that it's a gateway drug, and I know many of you. I've testified in front of the Board of Supervisors many times. Are against me because of that. I think marijuana should be dispensed in a pharmacy, not because I want to get wealthy from it, because I don't. I don't appreciate having to dispense habitual drugs to people who do not need them. But this in some way is very predictive of poor outcomes or indicative that we need to have concern about our heart health and our outcomes of patients using marijuana. I think it's a very good thing to start thinking about. Marijuana has several benefits in medicine, and we don't want those to disappear, particularly with treatments such as chemotherapy. And we don't want to underestimate the value of those. And again, I'm not opposed to medical marijuana. Medical marijuana, I've always supported it. I've listened to people testify how much good it's done them. My problem is those of you who are growers are telling us you're growing medical marijuana, but are not. You're growing recreational marijuana. I'm not for that. I never have been. If it's being grown, I want to tax you. I want to get money for other venues. If the public speaks and says that's what they want, then they need to pay for it. The potential harms of recreational use and the lack of regulation makes it difficult for users to know the amount of THC they're getting. I know when you go into dispensary, they're going to have anything from a medium amount of THC to a great preponderance of THC. Some as high as 99%, and it used to be around 10%. This drug induces a chemical imbalance and psychosis contained in a close, which can be a dangerous environment. And we're still not certain whether the THC is principally responsible for the new cardiac problems, but it's a topic that needs to be studied. If you remember right, it's hard to find a recreational marijuana user that only uses recreational marijuana, does not use opiates, does not use other drugs, usually in the illicit category of medications. I'm very much in favor for medical use. The people, I know very few people who are chronic marijuana users who are not without their share of problems. Of course, I know a lot of people that aren't marijuana users that aren't without their share of problems. But it's like anything else. Just like when we say diet and exercise, diet and exercise, diet and exercise, those are the way to cure a lot of the problems we have with our health. As a whole, more research needs to be done regarding the effects of marijuana on heart health. This is a retroactive study or retrospective study that so we cannot determine really what causes it between marijuana and weakening heart muscles. Further research is needed to evaluate this study. But what the study says is now that this is so dominant in our society, and for some reason the public wants to make it legal and has in the state of California, whether it's for economical reasons or for whether it's self-medicating reasons, which isn't medicine. It's like alcohol. Many people choose to drink, and it's legal to do so. It hasn't been legal for years to use recreational marijuana, and now the voters have decided they want it legalized. I'm not sure the reason they want it legalized. Is it because the penalties of raising it were too severe and a lot of people went to prison and jail for it? I'm not sure. But the public voted, and it's going to become law, and you need to know there are risks involved as well as benefits from the medical use of it. Yes, a lot of Vietnam veterans, which I'm one of them, but I'm not a marijuana user, have used that to adapt to society because of PTSD in Iraq and Afghanistan, and it's become a drug of choice in many situations. And if you'll talk to physicians who prescribe marijuana, excuse me, they have decided that it's a replacement for alcohol or other kinds of antidepressant drugs, even though it is a depressant, to treat PTSD and other kinds of disease manifestations that occur when people are under stress. But realizing what I just told you about stress cardiomyopathy, which is a weakening of the heart, of the blood vessels that go to the heart and stimulate a heart attack, there's also a huge risk for stress-related cardiomyopathy with the use of recreational marijuana. Now what we have to do is isolate those people who are taking medical marijuana or recreational marijuana and eliminate the illicit substances that they're taking along with it, and just have it be pure marijuana with THC or the oils and see how much of this cardiomyopathy results in the use of just it alone without the use of other ingredients. So there's a lot of things that we have to start looking at now that we never did before. And as I've listened to many people say, there's no problem with it, and it's healthy, it's a cancer cure, and all those things. There are other things that we need to look at along with it. So just be cautious if you're one of those people that think that that's your drug of choice. We have different ways of measuring it. We need to develop systems to measure people who are under the influence while they're driving. A whole new thing. We just had a whole new government put into effect nationally. Things are going to change. I think your biggest fear is about Obamacare, and it's definitely going to change. How much it's going to change, I think President-elect Trump has decided that you can't repeal it and give it a rebirth. You have to keep some of the items that we've had in there before, and maybe even make those better, and change a lot of the things. California, there was an article in the Press Democrat today about how people are concerned about the use of Obamacare in the future. It will probably take the most of 2017 to get it changed, but there will be immediate changes. What those immediate changes are, I can't tell you. One of the things that helped defeat the Obama administration was Obamacare, because it didn't work. Yes, there are those of you who have insurance that didn't have insurance before, but there are many people that went broke trying to institute that. And the state of California cannot survive without federal money to back it up, as we saw in the Medi-Cal transition on Proposition 52. The states that were hospitals that were treating Medi-Cal, state welfare patients, could not afford to treat them without the matching funds from the federal government. So some way there's going to be an obligation to the federal government for instituting health care. Health care has been broken in this country for many, many years and needs to be fixed. And when you fix something that's been an entitlement to a lot of people who didn't need the entitlement, and for a lot of people that did need the entitlement, the ones that didn't need it will find it more difficult for the transition. But then maybe you have to get a job if you're healthy and can get a job, and we're hoping that those are created, as the president-elect said that he was going to do. And I'm not for or against the new administration. I just think we need change. However change can be activated, and it's a positive change, I think we need to rush forward and accomplish those changes. This is a country by the people and for the people, not by the politicians for the politicians. I don't care what side of the aisle that you sit on. The people are who you serve. And the people spoke and said, we want things changed. So I think we need to cooperate with administration, not fight an administration before you even know what it's going to entail. I was embarrassed when I went to the Midwest and found out what was going on in Oakland, and we had 6,000 and 7,000 people shutting down the freeways and burning the Chamber of Commerce in Oakland and burning up police cars. That isn't the way we make a transition. We honor what's here. We do our best to make it work. We're going to take a break, and when we come back, we're going to talk about a new alternative for the EpiPen. Hi, I'm Bill Kearney from Northlake Medical Pharmacies, and recently I spent some time with some of the students in Mrs. Goodwin's third grade class at Lakeport Elementary School to discuss the importance of taking vitamins. I asked the students, why is it important to take your vitamins, and here's what they had to say.
They give us big, strong muscles. They make us healthy. They help us grow tall. They're good for our eyes. They help us fight colds. They are good for our hearts. They are good for our hair. They are good for our teeth. They give us strong bones.
Northlake Medical Pharmacy, a good neighbor pharmacy, is offering a Healthy Kids Free Vitamin program to the kids of Lake County. Any child aged 2 to 12 can receive a free 30-day supply of children's chewable multivitamins every month for a year. Simply sign up your children at either of our 2 locations at 347 Lakeport Boulevard in front of the Bruno's Shop Smart. Call 263-1328 or at 5136 Hill Road East across from Sutter Lakeside Hospital. Call 263-6192. The Healthy Kids Free Vitamin program at Northlake Medical Pharmacies.
They're good for us.
For nearly every woman, there's a moment.
My name is Alyssa.
A moment when she realizes, despite all the progress that's been made, barriers still exist for women and girls.
My employers thought it was nice that I had an advanced degree in addition to my work experience, but they weren't willing to pay me for it.
For Alyssa, a wife and working mother of 2, her moment came after reading an article on pay inequity.
In that moment, I knew I had to do more for myself, my family, and for other women.
Alyssa became a member of AAUW.
In joining AAUW, I want to help pave the way for my daughter and young women whose futures aren't yet defined by boundaries.
Join us in breaking through barriers for women and girls. Visit aauw.org to find out how and to connect with an AAUW branch in your community.
Attention savers. This important message will change how you save. The Treasury Department is eliminating paper savings bonds from the payroll savings program and going green with Treasury Direct. Treasury Direct is a convenient, secure online savings program that makes it simple for you to purchase electronic savings bonds directly from your paycheck, checking, or savings account. So go online and change how you save today. Visit treasurydirect.gov to open your free account.
A public service message from the Department of the Treasury.
Sleepless nights, plenty sleepless nights. Waking up in the middle of the night, can't go back to sleep.
Like when I first came back, it was kind of weird because like when I would be driving and a traffic light would go out or a light in the road would go out, that would kind of make me nervous because I'm thinking that at any second now something's going to explode.
I mean, that destruction. I mean, that's something that stay with you, and it surfaces.
Normal reactions to an abnormal experience. Military life and combat trauma can have a lasting effect on your mental health. If you or a family member are having trouble coping, remember you're not alone. It takes courage to ask for help. An anonymous self-assessment is available online and by phone. Take the first step to healing. Visit militarymentalhealth.org or call 877-877-3647.
Okay, we're back.
Well, before we left, we were going to be talking about a new EpiPen alternative. It's not really on the market yet. It's called AviQ. It is going to be a much different picture of what the other one was. It's the people that invented it were some twins that have severe allergies and parents of allergic children. They take it very seriously. In fact, their own experience growing up allergic to almost everything that drove them to invent the device. When they were 3, they were labeled as some of the most allergenic children their physician had ever encountered, where they grew up allergic to all eggs, peanuts, trees, nuts, seafood, fish, shellfish, most antibiotics, and all insect venoms. Back in the 80s, there was wasn't a lot of awareness about allergies. We were those kids that had to sit alone at a table because they weren't a peanut-free zone back then. They had epinephrine with them at all times, but once they were in college, they struggled to carry it. So their whole goal was to invent a different option. Well, how is this one different than the EpiPen? Well, it's smaller. For one, AviQ is the size of a credit card and the thickness of an average cell phone. It isn't for looks, but rather to increase the odds that it's going to be carried every place. And anybody that says they can't carry it, look in their back pocket, and I bet they have a cell phone. So they've had to respond to their own children having an anaphylactic reaction, and it doesn't matter what epinephrine device you use. It's readily available with you, and if it's not used correctly, it could be tragic. There's a step-by-step instruction that walks you through by voice what to do in the moment, including where to place the device, the thigh, just like the EpiPen. It's an intramuscular injection, just like the EpiPen, and you hold it in place 5 seconds instead of 10 seconds, and it is about empowering people, even ones that are untrained, like a babysitter or a neighbor, to manage the emergency situation. Because the fact that you might not be with your child when a reaction occurs, many times you've probably taken your child to a party or soccer practice and handed the EpiPen to a terrified-looking mom or dad while instructing them to jab your kid in the thigh in case of emergency, and they looked panicked when you left. So another safety innovation of this is fully retractable needle, designed to prevent the needle from breaking off and getting embedded in the child's leg. Other epinephrine auto-injectors are required by the FDA to include safety warnings that this could happen, but this actually can happen, but not with this device. As for the million-dollar questions, excuse me, or maybe the $600 questions, is the AviQ going to cost $600? Nothing definite yet. They understand the price is central. Their focus is to ensure that out of the pocket cost to the patient will be low, and that's all we can give you at the time. It's going to be called AviQ. It will be advertised heavily. I'm sure the insurance will pay for it as a less expensive venue for EpiPen. And although EpiPen says they're going to lower the cost, they don't say how much. As we all know, competition forces you to be more competitive. We have that in our pharmacy business. We compete with CVS, Kmart, Walmart, Rite Aid, and we have to, as well as give better service, be competitive. And we try to be very correct about that. There are some times that we miss those opportunities, and then you tell us about it, and we'll do everything we can to make that more viable. You know, I didn't think about this, Paul, until I was coming back from Iowa yesterday, but I came across from Las Vegas to California, and I saw a fire, a forest wildfire.
Oh, wow.
And I thought about, and I saw the smoke from the airplane. First I thought it was a geyser or something like that, and I think it was between actually Des Moines and Las Vegas in the mountain part there. But I was thinking about what that would do and what our fires were here like when people were breathing that smoke.
Oh, yeah.
And this just isn't an issue for those living close to wildfires. If you remember, right now in South Carolina and North Carolina, where I'm going in about 3 weeks to Atlanta, actually, they have carried that smoke to cities that are miles away. In Atlanta, where there are no wildfires, the air quality level is unhealthy, which means everyone may begin to experience health effects, and members of sensitive groups may experience more serious health effects. So those health alerts in South Carolina and Georgia, as well as parts of eastern Tennessee and western North Carolina, are like they were here last year and the beginning of this year. They continue to burn. There's little hope for rain in the forecast because of El Nino in the Pacific Ocean. Also has a great impact that's predicted to cause drier and warmer weather this winter in most of the United States. So this wildfire smoke can actually make you sick. And how do you reduce the smoke in the sky? Do you need to worry? Although the cooler temperatures may bring more appeal to the outdoor activities, the smoke exposure isn't worth the fire risk. There's particles of burning vegetation and building materials and mixed with gases. If your eyes feel like they're stinging, smoke exposure could cause you to be inflicting other damage. I had to quit wearing contacts during the smoke here because I couldn't keep them in. They would irritate my eyes so much. I was talking to one of the people at the my sister runs a food cupboard in southern Iowa, and I'm sitting down talking to people about the fires in California. And almost everybody knew where Clear Lake was and about the fires last year. And we were talking about how that happened. And somebody said, I didn't know until I went to Southern California and there was fire up around San Luis Obispo or someplace, that how these fires could spread so far. And I looked at the vegetation and I looked at the forest when we went over it and saw all the dead trees and things, and I realized how fast these fires can spread. And they do. And so it gets to the point that it affects everybody. And even, it was bad in Sacramento when the fires were going up in the Tahoe area, and they were going down here too, and they funneled into that valley. And that exposure can cause chest pain, a fast heartbeat, wheezing, or bringing on an asthma attack. We sold so many inhalers on prescription and over the counter that were steroidal prescriptions that are over the counter now. But it could be especially harmful to the elderly, of which we have a large population of, pregnant women and children, and those with chronic heart and lung disease. Actually, I didn't realize this, but children breathe more air per pound of body weight than adults. They're always and are still developing. They may experience more severe symptoms, so their lungs aren't fully developed. Their hearts aren't fully developed. Those with asthma or lung disease should consult their doctor about navigating situations like this. Some people may even experience illnesses like bronchitis due to the fine particles. I had a doctor's appointment the Monday before I left, a week ago last Monday, and my ears have been filling up and draining like crazy, as you probably hear on this radio station. And I asked the physician what was the difference, and he says when he first started practicing here about 30 years ago, there was about a 17% of the population that had bronchitis. It's now 41% that have it. And he said it has to do with all the fires, the change of environment, the dryness. That's why there's such an increase. So it's pretty hard to stay healthy sometimes when it's smoky. So if you see a haze or smell smoke or know of a wildfire in your area or a place you plan to visit, just like I am in 3 weeks in Atlanta, if this doesn't go away, check the air quality index to see whether you need to limit your time outdoors. I'm at a board meeting at St. Simon Island, right off the coast of Brunswick, Georgia, and one day that of the 4 days we're there is a board meeting from 8 in the morning until 11 at night. Then one day to get there, one day to get home, and then the other day we're going to be outside fishing or playing golf or hunting quail. So we're going to have a high exposure to that smoke. When you're advised to stay inside, keep your windows and doors closed. It's okay to keep the air conditioner going, but make sure that the filter is clean and close the fresh air intake to prevent smoke from entering. It's often important, excuse me, to keep the indoor air clean. A lot of people now are starting to use candles, wood stoves to heat their houses, but burning candles are one of the things that put a lot of bad things into the air. Using a fireplace or gas stoves or smoking, running a vacuum can also keep particles circulating in the air. Dust masks actually trap particles and don't protect your lungs from smoke inhalation, but a mask that uses the filtering respirator can often serve some protection. When we're compounding in our laboratory, we will be compelled after the first of the year to have masks on that have a filtering respirator on, so we don't breathe any of those things in. So those kind of masks are better. Even if the air outside of your home looks clear, it may not be. So be very, very careful. We're trying to find ways to make you better, not to get you worse. So some of the things we talk about might not involve you, but many of them may. There's a cholesterol drug that shows promise to reverse heart disease. And Paul, for a long time, you took no medication, right?
That's right, yeah.
You were just healthy. And you still...
I thought I was healthy, yeah. But
well, you still feel healthy, and maybe losing this weight, your blood pressure will go down.
I'm hoping, yeah.
And you're not really high on blood pressure.
No.
You're just on the edge.
Yeah. You know what else the cardiologist said that was kind of interesting was in looking at my echocardiograph, I guess one of my valves has a prolapse on it.
Takes it a while to close.
Is that, well, he says that usually, it kind of closes and they close up like this. Mine sometimes will extend beyond and open a little bit.
So it'll leave it open. And
then he said there could be some leakage. And he said that could have been maybe some of the cause of some of the pressure in my chest that I was feeling and minor chest pain. He said that, really there's not much you could do about it or worry about it at this point. Obviously if it starts to increase, then I don't know if they'd have to go in and rebuild it or what the procedure would be. He didn't really say.
Did they think it was congenital, that you were born that way?
He thought it was genetic. That's what he said he thought it was. So, yeah, I could have been, but how would I ever have known?
Yeah, you wouldn't.
I wouldn't, yeah.
You even had thoughts about taking that echocardiogram because you didn't feel like there was anything there. Yeah. And that's what those things can do. Have you taken the stress test yet?
He said I didn't need to.
Good.
He said everything looked really good, other than the little bit of the high number on the low end of the blood pressure. I don't know if that's the diastolic or
diastolic. Yeah.
Diastolic. Other than that, and he prescribed me a mild blood pressure medicine. He didn't think I needed to. And he had asked me, he said, have you, done any type of physical activity? And I said, well, I went bike riding with my son, and other than trying to pop a wheelie to show off and falling on my backside, I felt great, and he said, well, as long as you're not feeling like, your everyday activities going up and down the stairs out back like I do every day doesn't wind you or get you, any type of pain. And I haven't had any pain since, for months now. And I asked him, I said, well, when I first came in, I had just quit smoking. And I said, maybe some of that weirdness I was feeling might have been related to not having the smoke in my lungs on a regular basis like I had before. And he said that's a possibility. People sometimes can get confused between lung pain and heart pain and chest pain. It's all kind of in the same area. But according to him and my results, he didn't feel like I necessarily needed to go in and do the stress. So he does want me to go get a panel so I can look at my cholesterol, which last time I did, my cholesterol was great, which was amazing because I was heavier back then, I should say. I'm still not where I want to be, but, I do need to go in there and get that. But he didn't think I needed to see him again unless it's recommended by my general doctor. So.
Well, we can never be completely perfect. I look at people that come in and do brown bag things with me, and I look at all their medication, and if they can have their lab results, I look at them. And some of them are taking a lot of medications, and their lab panels are great. I've always had a problem with a liver function test, and I drank more when I was younger than I do now, and by quite a bit. But I've always had, and my family has always had, an elevated liver panel. I take a drug called milk thistle, which keeps it almost normal, even not drinking, but it's still just a little bit elevated. And my HDL, which is supposed to be higher, is in the 30s, and it needs to be in the 50s, and my LDL is low. My LDL is in the 50s or 60s, but this drug that I'm talking about, it's a new drug given along with a statin medication, has proved to shrink plaque that's clogging arteries, giving way to do some undue damage to the heart. The differences were very small. The doctors hope it will grow with longer treatment and reversal or stabilization of the cardiac disease. Amogen, which is a big producer of biogenetic drugs and a lot of different drugs. This drug is called Repatha, and it drove LDL, or bad cholesterol, down to levels that I've never even heard of, if ever seen in people. Heart patients are told to aim below 70. Like I said, mine's in the 50s. Some of these people got as low as 15. Now, we've never measured LDL low levels before because we didn't think it was possible. There doesn't appear to be any level at which there is harm from too little LDL. Remember, this is the bad cholesterol. And the lower patients went, the more their plaque shrank. And this was done at the Cleveland Clinic, which is a big cardiac testing institute. They were published yesterday by the Journal of the American Medical Association. Statins, like we talk about almost every week, such as Lipitor and Crestor, curb the cholesterol production. Repatha and a similar drug, Praluent, block a substance that interferes with the liver's ability to remove cholesterol from the blood. So too much cholesterol, along with other substances, can build up and form plaque. The new drugs have drawbacks, though. Statins are pills sold as generics for as little as 10 cents a day. The new ones are biotech drugs that are expensive to make. The new drug costs $14,000 a year, and insurance companies often won't pay. And this must be given as shots every 2 weeks or once a month. People can do it themselves with a pen-like drug pen. 900 heart disease patients were given a strong statin and monthly shots or a dummy solution. Ultrasound images were taken of an artery plaque at the start of the trial. The average for bad cholesterol stayed about 93 for people only given the statin, but dropped to 37 for those on both the drugs. Now, I don't know how low you have to get rid of this. My LDL is rated as very good. My HDL is bad, and they don't have any drug right now to raise the HDL. The amount of artery plaque actually stayed the same for the statin-only group, but shrank 1%, those also giving the Repatha. So some people with more dramatic LDL decline saw the plaque shrink to 2%. But if it only shrank 1%, it didn't say it shrank to 1%, it shrank 1%. That's an awful lot of money, and whether you get a clinical advantage of that, it's small, but it probably took patients 60 years to accumulate that plaque, so any change they felt like after just 18 months is good. I think it would be hard to convince an insurer that that's good. I'm only reporting it because it's new and it's out there. It sounds small, but it's a beginning, and of course the drug company says it's still a win. $14,000 to shrink my LDL by 1% is marginal to me, well, especially at my age. The Amogen sponsored the study, and Santos has consulted for the company. The best test of the new drug's value will be large studies underway now to see whether drops in cholesterol will lead to fewer heart attacks and deaths. Those results are due to be expected next year. Also at the conference, Dr. gave results of a safety study of an experiment treatment aimed at rapidly removing cholesterol after a heart attack to prevent a second one. So when you have a heart attack, your body's ability to get cholesterol out of plaque is actually worsened. Your plaques actually grow more plump. The pipes are even getting more clogged. The way to do that, they've tested infusions of a drug where the main component of HDL is included, or good cholesterol, which helps remove the bad kind. It's taken from the body and synthesized in a lab. As time goes on and as research goes on, there's more and more drugs that are going to keep us from dying earlier. My father died at 65, and at 65 he was ready to go. He died of a stroke, but he was an old, broken down man who'd been a farmer most of his life, worked hard labor, worked long hours, drank way too much, and it had its effect on his lifestyle. Now, he was poor. He was a sharecropper all his life. Eventually learned that he was an alcoholic, and he wasn't compliant on taking medication. He had medication to take to control his high blood pressure. They didn't have cholesterol-lowering drugs at that time, so he didn't take them, and if a doctor had told him to take them, he probably wouldn't have done so. So we need to realize, and at each of these meetings that I've made a presentation at in the last few months, I have explained to people how they need to be more compliant with their health. Healthcare is changing drastically. We don't know what it's going to look like in 4 years, even in 2 years. But I can tell you one thing, that you're going to have to be more responsible for your own health. Chances are in the rural area like this that you're seeing a physician that you may not see the next time you go in. A lot of hospitals and clinics are contracting with PAs, physician's assistants, and nurse practitioners, and they work under the auspices of a physician, but you may or may not get to see that physician unless you end up in the hospital. And if you end up in the hospital, it may be a hospitalist, not your regular physician, and they will have to get familiar with why you're there and get to know you, and then you'll be discharged and back to your physician. So it's a whole different world where we had one physician visiting you for everything, and delivering babies, treating you for cancer, anything that you can think of was done by a family practitioner. Today, everybody's specialists. They're surgeons, and they're not just surgeons, they're specialty surgeons. They're neurosurgeons, they're orthopedic surgeons, they're internal medicine surgeons. They're very specialized in what they do. So they will take care of the problem that they're in there for, and then you will have to see a cardiologist for your heart instead of a family practitioner. You'll have to see an internal medicine for your high blood pressure if it's complicated. You'll have to see an allergist if it's because of an allergy and you need an EpiPen or AVQ. So you're going to have to be, I had colon cancer back in 2003. I was taking medication for that, and I got better, and I was having a colonoscopy every 60 days, and then every 2 years, and then every 5 years. My gastroenterologist is left the Northern California area, or gone to the Bay Area. I was told to follow up with another gastroenterologist, and I have not done so. That's my fault, and that's not the smart thing to do. So, and I will be doing that. If my wife is listening to this broadcast, she's been hitting me over the head, but I'm trying to get her well first. So I just want you to know that it's your responsibility, not anybody else's. So the last thing I have is is trying to prevent falls. As if you're younger or older, you need to be concerned about your safety, especially if you're elderly. You take a good look at the environment within your home to make sure it's safe. Take basic steps to go a long way towards lowering that risk of falls. That includes eliminating tripping hazards, removing boxes, newspapers, electrical cords and phone cords, coffee tables, magazine racks. When my wife had a new knee, before they would even do physical therapy, in-home physical therapy, they had an inspection of the house, and the throw rugs needed to be picked up. The chairs that were in the way needed to be picked up. Simply remove the rugs, repair any loose floorboards or carpeting. Dishes, food, and other frequently used items need to be reachable. My sister has had 33 hip surgeries, and her height has decreased from 5'2" to 4'8", and she uses all those tools to get. Even has a magnetic finder to pick up coins or something that she's dropped on the floor, but to reach high-level places. So be sure and do those kind of things. And if it's your grandparents or parents and they're elderly, take a look. A few adjustments might help. A raised toilet seat can make it easier to get up and down. Installing non-slip mats or grab bars. We sell most of this at Northlake Medical Pharmacy, so if you're looking for those kind of appliances or those kind of tools that can help somebody navigate around their home, be aware that they are available here locally. In this little time we have left, I'd like to remind you all that we're still doing immunizations, Tdap, mainly flu shots right now. If you're over 65, you haven't had your pneumonia shots, even Pneumovax 23 or the Prevnar 13. We still deliver, free delivery to all the places that we normally mention. So Kelseyville, Lakeport, Findlay, Nice, Lucerne, Upper Lake. I got to go now. So got to remind you that we're Northlake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital, and at 347 Lakeport Boulevard outside the Bruno Shop Smart. Call us there at 263-1328. And be tuned in next Wednesday for our annual Thanksgiving show.
Gobble, gobble.
Gobble, 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 gobble.
Gobble, gobble. All right, we'll see you back here 10 a.m. next Wednesday on Thanksgiving Day Eve for Health Talk on AM 1270 and 96.5 FM KXPX Lakeport.